Welcome to Key into Quality, where we explore the foundations of a thriving quality culture in healthcare. I'm Dr. Tim Morgenthaler, a professor of medicine and a vice chair of quality at Mayo Clinic. Today, we're going to talk about the critical role that individual and organizational resilience plays in an organization being able to achieve and sustain quality over our current rapidly changing environment. Co-hosting with me today is Dustin. Dustin?
Welcome to everyone joining us today for this conversation. I'm Dustin Flannery, a performance improvement advisor at Mayo Clinic. And today we have a unique opportunity to talk to a subject matter expert in an area that I've heard feedback from not only just internally at our organization, but externally other organizations are really trying to dive into this topic and glean insights and how to progress forward.
Yeah, Dustin, this is the important topic that nobody really wants to talk about. But, the ability of organizations to anticipate, respond to, and recover from adverse events is very tied to healthcare quality. The COVID-19 pandemic underscored the importance of that because it forced very rapid adaptations to challenges like virus spread, evolving treatment protocols, unknown and misinformation, and many infection control measures, just all kinds of new things. And the most resilient organizations successfully reconfigured all their operations. They optimized different resources. They implemented solutions like telehealth. They did all sorts of things to try to maintain healthcare quality. The pandemic is probably behind us, at least for now. There could be another one. But I would say that the pandemic's effects are still with us. There still are supply shortages, and there are still a lot of staffing challenges. And this has been really stressful to individuals. So now individual resilience amongst healthcare workers comes to play a crucial role. The resilient individuals can enhance the team dynamics and support. They can contribute to the overall organizational ability to respond to challenges. And I would say that these challenges these days are coming on so fast and so furious and so diversely that it's placing very unique burdens on healthcare workers, and they're having to respond in ways that they've never done this before. So this is a very tough space to navigate, talking about burnout individually, talking about resilience individually and organizationally. But today we have some great help from our guest, Dr. Lisa Hardesty. She is a clinical health psychologist and consultant in the Department of Psychiatry and Psychology who works in our Mayo Clinic Health System, and she's here today to help us talk about this. Lisa, welcome. Maybe can you just tell us a little bit about yourself and your interest in these areas of burnout and resiliency?
Yes, absolutely. Thank you, Dustin and Dr. Morgenthaler. So I was trained as a clinical health psychologist, which is that biopsychosocial model or the whole person, the mind-body medicine connection, if you will. So my entire career, I have been interested in this space to a degree. And it's interesting in a way, if I think about the threads throughout time, we've talked about stress, we've talked about burnout, we've talked about resilience, we've talked about bounce back. And in some ways, it's really the same topic, but yet different ways of looking at it. And yet, I would say I have been here at Mayo Clinic for 26 years. Definitely the pressures, the external pressures seem to be higher than really they ever have been. And I would agree the pandemic has continued to impact us in the future. So strong interest in this area. And in my 26 years here at Mayo, when I first came on board, I started a stress management program for employees, recognizing that when we work in healthcare, this could be a stressful job at times, certainly. I also have constructed a physician efficiency learning lab, which is about time and energy management and how do we show up and be our best selves. But going back to what you did talk about, Dr. Morgenthaler, it is really how do we show up as our best selves at work? How do we show up so that we aren't empty in our tanks so we can give to our patients and each other?
Yeah, boy, I really know, I and my colleagues, we feel that every day in one way or another. And I think all of us are learning that we have to pay a lot more special attention to how to regulate ourselves and how to help one another.
We know staff burnout among healthcare workers is a concern. What are some symptoms that show up at work, and what should leaders be looking for?
So, as with many conditions, there is a range. One end, if we want to look at these as bookends, one bookend might be someone calls in a little bit more often. They seem to be a little bit off or perhaps not themselves. On the other end of that bookend may be someone who you ask, "Hey, would you mind going to get that bedpan for patient in room 44?" And brah, there's a big a big outburst, and you wonder what just happened. I just needed a bedpan. So we may see symptoms such as difficulties with focus or concentration. Someone seems, again, just a little bit distractible. We do see more presenteeism and absenteeism. So folks calling in, not showing up, but also being there and not being there. You see more cynicism, perhaps, a little bit more frustration, someone who's truly empathy and comparing compassion. I think there's not a healthcare worker out there who doesn't embody that to some degree, but they seem a little bit more cynical or negative, if you will.
Well, Lisa, tell me a bit more about that. I'm thinking of the interesting word that you used, presentism. Was that the word?
Yes.
So it's easy to know when somebody's absent, but tell us, as your professional opinion, as you're watching someone, how do you know, or what are your suspicions that you think, well, maybe this person is not really checked in?
Yeah, great question. I would say it's a lack of responsiveness. So that email that doesn't get returned or the usual job responsibilities, if you will, aren't getting taken care of. Some of those are just symptoms of distractibility, lack of focus, not being engaged. They're not coming to our meetings. They're not showing up. If you're in the break room, perhaps, if we have break rooms anymore, but if you're sitting somewhere, they're not speaking to you. They're not conversing, and perhaps even work conflict, some more interpersonal conflict. That person seems to be a little bit more on edge or irritable. So
Yeah.
they're just not themselves, if that really is maybe a non-clinical way of looking at
Yeah.
it.
No, that's fair. And I have to say, as you were reading off some of those things, some of those are probably exactly as you're saying. They're sort of signs of burnout. I'm not a psychiatrist or psychologist, but I imagine are sort of self-protective mechanisms to some extent. But some of them may be that we're asking them to do so many things that they can't show up for all the meetings, or they're doing emails while they're in the meetings and so forth. So I wonder if you would share with us, what do you think are the major contributing factors to burnout in healthcare today?
How much time do we have?
Take a shot at it.
I believe when we ask staff, it is the staffing issues, the workload. You just mentioned that. And so I will piggyback on that notion, that pressure to produce, that pressure to see more patients because of our payer mix, perhaps. I think payer mix and how we are getting reimbursed as a healthcare organization and medical care is certainly impacting us. There is less control. I had someone earlier today, a nurse, she said, "You know what? When I was first starting out, I just decided and then we did it and we did it together." And I thought, boy, that might have been true, but when was that true? Maybe during COVID when we had to react and respond with a sense of urgency. But boy, those days of really deciding, and maybe autonomy is a word that gets thrown out a lot. That it has been a while as we continue to see that pace of change within healthcare move so quickly. In the workplace, and this could be true for any business, is autonomy, mastery, and purpose. And when I think about all three of those, I think, do we have mastery? I hope we're all working to the top of our license, if you will. Purpose, we can sometimes lose that in the rapid pace, and perhaps we're short staffed. And so I'm running around and not having the time. And then autonomy. So I would definitely say all three of those areas are impacted.
Lisa, at the beginning, Dr. Morgenthaler mentioned the dreaded B word we're not going to talk about, right? It's burnout. That's the topic. So how should we present this topic to staff, and what things should we be doing or not doing? And how are we able to support the staff?
Yeah, it feels like a teeter-totter balance, right? Doing enough of this and yet not tipping over to the other way. So certainly listening, and yet when you listen, make sure you respond. So what are we going to do with this? What's possible? So if a staff member says, "We're short staffed. This is ridiculous. I'm feeling very stressed out, burned out." There aren't any nurses to hire. There isn't anyone to bring into environmental services. So that's that other side of that teeter-totter, if you will, is to be able to say, here's what we can respond to, and here's what we cannot as leaders. One of my favorite efficiency measures, if you will, is a stoplight report where you have green, yellow, red. So I can actually tell you this is red. We're not able to impact this now. This is green. It's a go. And if there is anything we can engage our frontline staff in solving and adding to some of that autonomy, innovation, creativity, that can help. So listening, being able to think about the work that we are all doing. There's some great research Dr. Shanafelt, prior to his departure from Mayo Clinic, he had conducted with physicians that if they are doing 20% of their work as meaningful work. So can we have that within our staff? Can we understand what drives them? What is their purpose? How do we connect them to values, to the patient care so that they see how their work impacts patients and healthcare?
Well, thank you, Lisa.
So Lisa, that's very helpful, your comments about what can leaders do. Wonder if you have some thoughts about what should we not do. When I say burnout is like the thing that's very important that nobody wants to talk about, just my personal opinion and what I see shared from colleagues is sometimes the healthcare workers feel like somehow burnout is their problem. They're at fault for that. I think that's maybe what Dustin was referring to, is like, what are the things we shouldn't, or the approaches we shouldn't take?
Yes, I really appreciate you diving into that. There's even terminology, which is victim shaming, right? Why are you distressed about what's distressing you? And so I think to be cautious with that and to understand, and I'm going back to where you started and led us off today, organizational resilience, leadership resilience, individual resilience. Expand your mindset and how we think about resilience and bounce back and burnout, and to look at it in a multi-tiered, multi-fashion way. So we're not just looking at what can you do to fix you? You must be the problem. And so to really avoid any language that sounds like that. So great question.
And to aid with that, Lisa, what are some resources and tools we at Mayo provide staff to assist them in their journey to strengthen resiliency?
At Mayo Clinic, I think we do a great job. I'm proud of our efforts. And we have our EAP. So many organizations, I hope, have at least alignment or understanding of where those resources are for EAP. We have a very robust well-being office, and they offer, we have well-being champions. So someone who I know is in my department, I can reach out to that person and they can connect me to resources. Embedded in that are mental health efforts, which campaign It's Okay to Not Be Okay, resources for leaders, resources for individuals. We have a program for clinical staff that might have a difficult practice issue or a bad clinic outcome, and they can reach out to a peer, and that peer can assist them after that challenge. In addition to those resources that Mayo Clinic offers, there are national resources. For instance, the CDC has NIOSH, which is through their National Institute of Occupational and Safety and Health. And that is kind of a step-by-step program for organizations. The U.S. Department of Health and Human Services also has a program, so we don't have to recreate the wheel. American Medical Association, American Psychiatric Association, American Psychological Association all have great resources nationally for those that are looking for things. And I just recently was at a hospital that they offered Headspace, which is an app to their employees. So challenging healthcare organizations to think about what kind of things can we offer as resources for our individual staff, frontline staff.
As I think about what you've talked about, I want to go back and pick up another thread. You mentioned purpose, having that sense of purpose, and Dr. Shanafelt's work earlier that, if at least 20% of the time that you're working, you feel like it's connected to your purpose and what your passion is. What would your advice be to leaders about how to weave in and reinforce purpose in everyone's work?
So I'll give simple to the complex, right?
Go for it.
Simple may be a conversation. Why did you come into healthcare? Followed by, why do you stay? Coming back to that core purpose. Well, this just aligns. I don't want to work in X industry. I want to be here. So a connection to the patient. We have done some interventions, for instance, with our digital folks who spend a lot of time in data to say, here's the impact on patients. This quality improvement project, here's the actual impact on patients. So tying it back and letting individuals understand, if they're not that frontline staff, where they can see the impact. More complex is to understand those drivers, what really lights that person's eyes up when they start to talk about their passion and purpose. And then is there an opportunity for them to do a little bit? Can I find a committee to help? Can they start something? Let's start some great grassroots endeavors. Let's help them be part of that change. Let them lead that change, most
And then that's
importantly.
empowering that autonomy again. So if you can get up the
Yeah.
empowerment of autonomy with, sort of stressing their values and their purpose, that's where you really get a lot of power from that. I just earlier today had the opportunity to hear a report from some of our experts in patient experience. And it was very interesting. What they were finding was that when they analyzed patients' comments, to the extent that they talk about how they have seen Mayo Clinic employees exemplifying our values, to me kind of spoke on this burnout idea. It's like when I can live out my values that I really fully endorse, then I'm less likely to feel and be burnt out. And that is going to reflect in how others see what I'm doing. So important. Lisa, we can talk a long time, but what do you think's on the horizon within this space? I think, most in healthcare have been hearing about how important it is for us to take care of our health, to implement personal wellness programs and be much more conscious of getting enough sleep, eating right, getting enough activity, trying to work out our work-family balance and so forth, work-personal balances. I think we've all heard about, mindfulness techniques and all of these things. What do you think is really next in the space of burnout mitigation and organizational resilience?
Such a big question. To sidetrack a little bit, I read an article today in the Harvard Business Review on individuals that are using AI to help with their productivity and clerical tasks, which I am so excited about ambient listening. And I can walk out of my patient office and be done with my notes. I mean, I'm cheering along for that intervention. And the more that employees were using this AI, the more that they were efficient, the less connected they felt to others. So
Oh,
I think
uh-oh.
what I would have said I was excited about, right? I might alter that a little bit. But I do think that getting us all back to our time with patient care. We went into this profession, no matter what you do, because we really want to impact healthcare. So anything that takes that clerical burden, but also on the other side, keeps us connected with each other, that we come together as teams, that we have time together to problem solve, to really solve those big issues within healthcare. That is exciting to me. And I think kind of comes back to our discussion about purpose to really get us closer to that. When you think about some of the innovations that came even out of COVID, telehealth, I'm working with someone who's not able to get into our clinics in person. I'm able to see him through telehealth. That would not have happened. He would not be receiving care if it weren't for that. We have mobile apps, we have wearables. We now know what's happening with our patients. How are they sleeping? How are they eating, et cetera? And so I think when we do reduce clerical burden and start to see and work with that whole patient and be able to extend ourselves into patient homes. The days of the doctor coming here with my little black bag in my hand, we can get back to that, but in a more virtual manner, and we can extend ourselves. That's exciting. And I think when we get more of that, we're going to see engagement once again and less burnout. Back to what you had said, right? The more I have that purpose, connection with values, and can see the impact, and I'm here as a team with my other colleagues, I think we do start to see that burnout go down.
Lisa, is there any other thing that you would share that could help with staff with burnout?
As we were talking through a few things, I would say, again, another line of research is about the impact of leadership. We've talked about what leaders can do and certainly taking care of themselves so they can care for others. But there is some research, again, out of Dr. Shanafeld's work at Mayo Clinic, whereby my relationship with my leader actually was related to my level of burnout. So, how much I like and trust and work with my leader makes a difference.
Well, wow. Lisa, I just want to express my gratitude for your willingness to come and talk with us about this very important topic. Dustin, do you have any other questions for Lisa or thoughts that you want to share with our listeners?
I just want to say it's a pleasure and a privilege to be a part of this dialogue with you, Lisa. I think you've taken a topic that many dance around or walk on eggshells and have really put it into a positive light and show what organizations can do as they build resources and tools and activities to address burnout and to be engaged with their staff. So thank you for sharing.
And I think it's exciting that we can really point the way towards those who are leaders here, that the better we communicate and the better that we point the way back to purpose and values and are transparent in our communications and try to engage our front line, that really is the way pointing to hope now and in the future. So thank you again, Lisa. We have come to the end of our podcast. We're really glad that you could join us, and we hope the information and discussion that we've had is insightful and valuable. Again, Mayo Clinic's Key into Quality podcast aims to highlight some first steps in addressing important quality challenges in your organization. Our goal is to improve quality for patients and the populations that we all serve. If you enjoyed today's podcast, we'd be grateful if you left us a review on Apple Podcasts, a rating on Spotify, or feedback wherever it is that you listen to us. You can also follow us on your favorite podcast platform. Let others in your organization know about the podcast so the information can be spread. Until next time, goodbye.